The most important supplement for IVF patients. IVF patients want to maximize the chance of getting pregnant. So they want to know what supplements can we take in order to increase our chance of success. Lots of clinics will give lots of stuff. So they'll give a lot of supplements to the men as well. They'll give things like CoQ and antioxidants and all kinds of vitamins to the men, saying, oh, this will help to improve your sperm count or sperm motility or reduce sperm DNA fragmentation or some kind of rubbish. Men don't require any supplementation because no supplementation really helps. When you're doing IVF ICSI, all you require is a good embryologist, because that good embryologist can work magic and put one single sperm in one single egg to make an embryo. So the supplements for men, really complete waste of time. But I guess it gives the man something to do. So I'm not too fussed about that, but they're often just a complete waste of money. Supplements for the wife are important, and these are medical supplements. The most important, of course, is folic acid, because that reduces the risk of the baby having a birth defect. So we give it to all women who are trying to get pregnant. This is called preconceptional supplementation, and this is true whether you're doing IVF or not. Lots of Indian women are iron deficient, which is why we put lots of them on iron. Again, not so much for their fertility, but to make sure their pregnancy has fewer problems. Similarly, lots of Indian women are vitamin D deficient, so that's simple for them to supplement. Some women have poor ovarian reserve, and we'll try various options in order to increase their egg quality. A lot of these are experimental and unproven, but they include things like DHE or dehydroepiandrosterone or low-dose testosterone, for example, with the hope that the egg quality will improve. But there is one important supplement which you do not need a doctor to prescribe for you, which every patient should self-prescribe for themselves. And that supplement is called information therapy. Now, if information therapy were available in an injection or a bottle or a tablet, I'm sure all patients would happily take it. The problem is it isn't. And the problem is it's free, which means there are lots of websites who will provide you reliable information with IVF. The problem is that there are lots of unreliable websites which will provide you with false information, and that's often misleading and confusing for patients. And then often patients aren't willing to put in the time and the effort. Lots of them say, I'm not an expert. Why do I need to be a specialist? I'm going to the best IVF doctor in town. That's his job. Let him do his job. And in fact, a lot of doctors will make it worse, because when patients ask questions, and every patient will have questions because the success rate is not 100%, these doctors refuse to answer these questions. Or they actually put the patient down by saying, why are you asking me these questions? You're not going to understand all these answers. So these are very complicated concepts. So I've done 5 years of medical college, so you're not going to understand, or it's all going to go above your head, which I think is very disrespectful on the doctor's part. Good doctors respect their patients. They understand that they have lots of questions. They'll do their best to answer these questions proactively. And the best way to answer questions is online through a website, which is why we provide the most important supplement for IVF patients online at www.drmalpani.com, which is information, so that patients know exactly what's involved in IVF cycle, what the treatment plans are, what the doctor is supposed to do, how to make sure you're getting the right treatment, how to choose the right doctor, what to do if the IVF cycle fails, how to take care of your IVF pregnancy. Patients have lots of questions, and doctors aren't mind readers. And doctors are fairly busy, so they have other things to do. The good thing about a website is it won't lie to you, and the information is there. So you can read it and reread it and share it with your husband, so you know exactly what to do when you start an IVF cycle.